Hi, I'm Dave Evans. I'm a physiotherapist at We Fix You, and the topic today is what to choose when you're injured, hot versus cold. Now, this is the most common question I do get in my practice. So let's start off with you get an injury. It's swollen, you possibly damage some tissues, you start to see a little bit of bruising. The first thing you need to do is to apply cold. Cold is the best application for acute injuries. Acute is something that has just happened within the first 3 days. So to apply cold, what you want to do is get a bag of peas or a bag of ice. Make sure that you protect your skin with maybe a wet cloth and then apply the ice so it's not directly on your skin. And you want to let it hold between 10 and 12 minutes. Now, that time frame is really important because a lot of people will hold that ice on until the ice is melted because everything numbs and it gets very comfortable for them and they feel that their pain's going away. But the problem is if you apply ice too long, the brain kicks in and it tries to protect that area. So it will actually flood that area with blood, which is what we're trying to avoid. We're trying to restrict the blood flow in the area so that the healing does not get damaged by all this blood flow. So those are the most important things. Now you need to make sure that you reapply that ice as frequently as possible for the next 3 days. The more you do it, the better. When do you reapply? You always do a test. You put your hand on the unaffected area. Let's say it's your right knee, and you want to test the temperature. Then you put your hand on the affected area, the injured knee. If the temperature is roughly the same or a little bit warmer, then you can reapply. Do not reapply if you put your hand on the affected knee and your tissue is still cold. Typically 30 to 40 minutes is enough time to rest prior to reapplying ice. But I would definitely recommend 4 or 5 application of ice, 10 to 12 minutes, and you do that for the first 3 days. Now getting into heat. Heat is something that dilates. It actually opens the blood vessels, so it's increasing circulation. And this application is applied after the 72 hours or in response to a chronic condition. If you have chronic back pain, you periodically get it or it's always there. Heat is one of the best things that you can apply. Now heat, there's no real time limit. You just want to make sure that you apply the heat to the affected area and at least 15-20 minutes, or that you can leave on longer. The biggest concern is to make sure that you do not burn yourself. So if you have low sensitivity to heat, you might not want to leave it on too long. Or if you're using a hot plug-in heating pad, that potentially could get too hot if your sensitivity is low. And definitely do not fall asleep with a hot pack on. I've seen too many people waking up with red blistered skin. So heat you can apply anytime as long as the temperature is not too hot, and you can apply that as frequently as you want without worrying about side effects of that. So hopefully that helps and you're able to determine what to use, hot versus cold. And if you do have any questions, check us out at wefixyou.com or give me a call, David Evans, at the We Fix You office in Cobourg or Port Hope. Thank you.